Everyone. My name is Elsie Tavares, and I am a pediatrician at Mass General Hospital and the Mass General Brigham Chief Community Health and Health Equity Officer. And I could not be more excited to welcome you all here today for what's going to be just an incredible announcement and an incredible event. It is my pleasure to welcome you all to the Mass General Hospital for today's exciting announcement. It's appropriate, actually, that today's announcement is happening here in the Paul S. Russell Museum for Medical History and Innovation, home of innovation spanning more than 200 years that have been game changers in the way we practice medicine and the way we do healthcare. And the reason why it's appropriate is that today we're here to announce an innovative partnership that will be another game changer. In this case, a game changer for students in the city of Boston, for our healthcare workforce here at Mass General Brigham, our patients, and the communities that we serve. We are here at Mass General Hospital, one of Mass General Brigham's 2 nationally ranked academic medical centers, where students from the Edward M. Kennedy Academy for Health Careers have engaged for over a decade in work-based learning opportunities that prepare them for roles in a wide range of health-related fields. We love welcoming you all. We love welcoming students from the city of Boston. And we have a long history of doing so here at MGH and at Brigham and Women's Hospital. The proven partnership that we have had with EMK and our 2 academic medical centers has helped us build a diverse, highly competent healthcare workforce for tomorrow, while improving economic mobility for young people and their families, just like the students that are here with us today, thereby breaking the cycle of generational poverty and improving community health and health equity, all central to our efforts under Mass General Brigham's United Against Racism initiative to dismantle systemic racism across healthcare. We are excited about today's announcement to dramatically expand this partnership, and you'll hear a lot more from our speakers today. I want to acknowledge a few people who have been able to join us for today's announcement. First, Jenny Kane from Bloomberg Philanthropies. Boston Mayor Michelle Wu. Dr. Ann Klibanski, President and CEO of Mass General Brigham. Dr. David Brown, President of Mass General Hospital. Mary Skipper, Superintendent of Public Schools. Dr. Caren Walker Gregory, Head of School for the Edward M. Kennedy Academy for Health Careers. Counselor Sharon Durkin. Dr. Tenley Albright, who serves on the Bloomberg Philanthropies board, and of course the wonderful students from EMK Academy who are here today to join us. It is now my distinct honor to welcome Boston Mayor Michelle Wu to the podium. Mayor Wu.
Good morning, everyone.
Good morning.
Thank you so much, Dr. Tavares, for all that you do for our community's health and well-being, but most importantly, sense of belonging and connection. We are so grateful to partner with you and so grateful for your leadership on this collaboration. I will echo the hello and good morning to all of the honored guests in the room. First and foremost, our stars of the day, our EMK students. Thank you for making this possible. And of course to their leader at the helm, who has been steering the district for many years now and making sure we have a vision of what's possible in our high schools, to the many administrators who represent Boston Public Schools from top to bottom, our superintendent and the entire team, the president of the Boston Teachers Union, Jessica Tang is here as well. Thank you for all that you do for our educators. We're joined here today by, I am told, Eric Estevez, the board chair of EMK, is here somewhere. He's in the back. And a special shout out to members of our team who were really important in thinking about this particular collaboration. Ted Lombardi, and Susanna Hernandez Morgan, who co-led the grant writing. Our Executive Director of the Boston Public Health Commission, Dr. Basola Ojikutu, our Chief of Policy, Mike Firestone. There were a lot of folks from the city involved to make sure we could give it our very best. And we have the very best partners that we were able to come together with. So thank you again to Dr. Klibanski and President Brown and Laura, Aaron, MJ, Mary, Reamer, Linda, so many others on the team we had the chance to get to know well. Eric and the entire team at Bain, your guidance also was absolutely instrumental in getting us here. So we're so grateful. And to our guests and visitors from Bloomberg Philanthropies, what a great day for the city of Boston and for many cities around the country that you are making possible today. Jenny and Lizzie, we are so thankful to know that those who love and believe in the power of city government are having such an impact everywhere and really reshaping our workforce and our education system. To Howard and CEO Patty Harris, and of course Mayor Bloomberg, it's been a joy and a privilege to get to know the entire team and to benefit from your wisdom across so many different areas for our city. As mentioned, we're here today in a museum named after a leader who, in addition to revolutionizing the field of transplant medicine, also understood deeply the importance of developing the next generation of health workers and leaders. Just over 60 years ago, Dr. Paul S. Russell created a clinical transplantation program right here at MGH. And since then, he helped train clinicians around the country and across the world in transplantation biology. It's fitting to celebrate the groundbreaking partnership between the city, the Boston Public Schools, Mass General Brigham, and Bloomberg Philanthropies today to transform and expand the Edward M. Kennedy Academy for Health Careers into an even bigger cutting-edge training ground for health professionals. For nearly 3 decades, the EMK has prepared Boston students for college and rewarding health careers, and they have been ahead of the curve in understanding that our young people are ready, are eager, are prepared, and are exactly what we need to step into the leadership roles to serve and care for our community. This collaboration will help take that incredible leadership and work to the next level. In the coming years, in partnership with Mass General Brigham, we will be able to double the size of the EMK to serve 800 students. We will add new pathways in some of the most in-demand career tracks, including surgery, medical imaging, biotech, and medical lab science. And we will offer work-based, hands-on learning with summer and after-school placements, career counseling to every student. What all of this means is that with their skills in hand, EMK students will be directly embedded at Mass General Brigham throughout their education and especially afterwards, with on-ramps and direct pathways so that EMK graduates will have the choice in front of them to choose between continuing their education in this field, benefiting and ramping up into exactly what the city needs, or going straight into a good-paying job at Mass General Brigham and serving their community right then and there. And this collaboration today is possible, I'm very proud to announce, because of a multi-year investment backed by the largest philanthropic gift in the history of Boston Public Schools, a $37.8 million grant from Bloomberg Philanthropies. Thank you. Just last week, I had the chance to give my second State of the City address and to share with residents across the city that for us in Boston, the priority is giving our young people the world, in the classroom, in our communities, and in every corner of the city, in every boardroom, in every operating room, in every place that we need leadership and we need potential and possibility. Our young people are that special ingredient that we just need to help support and grow. So as a core part of delivering on a promise, that means expanding early college and getting career-connected learning to every single BPS high school student. This partnership draws on the incredible resources and talent that exists all across Boston. We are working on similar ways to come together with our anchor institutions in higher ed, to employers who represent the leading industries that will serve and grow our economy, and our cultural institutions to give our young people not only the best education, but the best opportunities to apply that education in meaningful careers that will support their whole families. That is what this partnership is all about. We know that this will serve as a model, not just for what's possible within our district, and I know we're going to start getting calls from every other high school now to say, when is it our turn? But we know that this is going to spark a national revolution in how we think about the potential for young people to be directly embedded with our largest employers and anchor institutions in getting involved in making a difference right now. There's some outdated thinking about what the point of school or high school is, and the separation between what you do when you're a kid, right, going through K through 12 education, and then when you're a grown-up and you're in college and then finally able to decide about what you want to do. I think we break that mold every single day. It's obvious here in the city of Boston. Our young people are already not only aware and so involved in understanding the challenges of the world right now, but they're active in making a difference, taking leadership roles, stepping into jobs and careers, and already knowing what their interests are so that they can maximize what they will do to serve their communities. And so we've been very proud in the city to make that available everywhere possible, to connect every university in our city to a high school, and to bring our largest employers into partnership with the city of Boston. We know that our young people are the most important resource here in Boston, and we are so thankful to them for being the model for the rest of the world. Thank you so much. Congratulations to everyone. And I forgot my most important job up here is to very excitedly introduce someone who's been a partner, a friend, a mentor for me as I stepped into this role as well, President and CEO of MGB, Dr. Ann Klibanski.
Good morning. Thank you so much, Mayor Wu. We are just so delighted and glad to welcome you all to Mass General Brigham for this very special announcement today. We are thrilled to be part of what is truly a transformational expansion of what's a long-standing partnership with the City of Boston and the Edward M. Kennedy Academy for Health Careers, and that is thanks to the incredible support of Bloomberg Philanthropies. What do we do with this, and what can we make of today's announcement? What we will do is dramatically enhance our ability to train, educate, and diversify the next generation of healthcare professionals at such a critical time for our workforce. I want to thank Mayor Bloomberg and the entire Bloomberg Philanthropies team for their support, vision, deep engagement in the planning process that actually brought us here to today's announcement. Mayor Wu, I want to thank you for your exceptional forward-looking thinking and leadership, your commitment to our students, our young people, and our healthcare workforce here in the city of Boston at the most critical time for our workforce and our healthcare system. And we are so grateful to Boston Public Schools Superintendent Skipper and, of course, our friends, our students at the Edward M. Kennedy Academy right here. Mass General Brigham has long partnered with BPS around educational, mentoring, internship, and employment programs for high school and college students. Why is this different? We know and we have seen that our two nationally ranked academic medical centers, Mass General Hospital, where we are right now, Brigham and Women's Hospital across town, have a strong partnership with the EMK school to provide work-based learning opportunities for students in healthcare settings. Not just in the books, not just reading about it, but in healthcare settings to help prepare and think and imagine future careers in healthcare. This mission is more critical than ever, and I said that in the beginning, and why am I saying that, and why does that make this a different time? It is because healthcare systems across our country, in our city, in our state, and I'll say it again, across our country, are facing such significant labor shortages that we have never seen before. And we have this continued capacity crisis, which is stressing our providers every single day. Mass General Brigham right now, we have 84,000 employees. We have 2,000 vacancies, 2,000 active recruitment vacancies are going on all the time. And who are these people? They include nurses, physician assistants, surgical technicians, and laboratory technicians. So we hear a lot about the need for healthcare workers. How do we deal with capacity? How do we best take care of patients? What's our collective commitment to that as a healthcare system, as a city, as a state, as a society? And here it is, right here. Engage more people in thinking about the potential of careers in healthcare. And these partnerships we have talked about for many years, many years, but yet it's here. It's here today. So what's different about this? It's beyond the talking about partnerships. It's actually creating a partnership. It's engaging everyone who matters, and it's thinking about students. It's thinking about their future and what that means for their careers and for the healthcare workforce now and in the future, because all of these things will only grow over time. So these roles are high-quality career opportunities, and they are in growing fields. And that's the other important thing. We always think about what are the future career choices? What are those fields that will grow over time? Healthcare, those opportunities will only continue to grow, and they will change. Who we need to come into that? What are the opportunities for students? That will change over time. So what else is different about this is broadening out these opportunities. We need a robust workforce pipeline that trains and educates students. And I think the point that's been made is it doesn't start after college. Many of these choices don't even require a college. They require a young person with the ability, with the opportunity to actually think broadly about where they may have an opportunity in the future. So we are the Commonwealth's largest private employer, and we are committed to providing these opportunities to students from our local communities needing to access healthcare career pathways. It's the right thing to do for patients, for our communities, for our children, for our system, for our state. I could go on and on and on. But that is the perfect opportunity now where all of these things align. They all align. And that's what makes it a very special time for this partnership. I would also say something that's been highlighted many times before, and I think by many people, and I don't think we can say it enough. Our ability to break down generational health disparities depends on our ability to recruit and retain a diverse, culturally competent workforce. These are generational considerations. The kinds of things we're talking about today don't affect a person. Of course they affect a person, but it's more than a person. It's a family, it's a community, it's a city. It's an entirety of a community based around the health of individuals, health of a community, health of a city, health of a state, and beyond. So currently, we've also broadened out the pathways, and Mayor Wu highlighted this, but I just want to say again, it's the expansion of the number of pathways. We have had nursing, emergency services, 2 great pathways. In addition to doubling the number of students, we now expand the number of pathways to 5, surgery, medical imaging, medical laboratory science. Why do I emphasize that? Well, it's the number, it's more pathways, that's important, but it is also that some students may find that they are more attracted to, after being embedded in these healthcare settings that we offer, in something that is more patient-facing. Others may find they are more interested and intrigued by things that maybe relate more to laboratory science and research. That's a different pathway. So I think having the ability to expose individual students to a wide variety of possibilities, some of which are patient-facing, some of which are not, some of which are in between. It just broadens the kind of thinking you have around what does it mean to have a career in healthcare. So all of these career pathways are exciting, but they will position students for future success. And I think that's the important thing about imagining jobs of the future. We are seeing the need now, but we are also projecting the need in the future. And if you're a student, you're thinking about what's here today, but you have to be also thinking about what's here tomorrow. And that's what we're collectively all thinking about together. These are high-demand healthcare careers. I mentioned there are 2,000 vacancies. That's an enormous number. I don't know what the future will hold, but I suspect, given the healthcare demands right now, those opportunities will only grow over time. So I'll say it again, this initiative will tackle economic mobility, and that is one of the most important concepts around social determinants of health. These jobs will break cycles that have been in place for a long time. And we can do that now, and we can do that together. So it's an exciting moment. We're deeply invested in the success of this program. Everyone who's speaking today, so many people in the room. It's the collective investment, and it's the collective accountability. We will be nimble. We will watch the successes. We will modify as needed. And I think that all of the success for students, for family, our community members, that's what we want to look like in terms of the future of medicine. So at Mass General Brigham, we're excited. We're ready to get to work as we embark on this expansion, and we look forward to working with all our partners at Bloomberg Philanthropies, the City of Boston, Boston Public Schools, EMK School, everyone here to make this a reality. Thank you. And now on to Jenny.
Thank you, Dr. Klibanski. This is such an exciting day to see so much work and partnership come to fruition. Mike Bloomberg believes that all students should have options and opportunities to get good jobs with good wages. For far too long, students have been left with one option, four-year college or nothing. And we know both students and parents want and need more options. There are so many well-paid jobs that don't require a four-year degree, but students need specific training and credentials to get them. And today, the majority of those jobs are in healthcare. This is where our project comes in. High schools like the reimagined Edward M. Kennedy Academy for Health Careers will provide students with training while they're in high school. So if they so choose, they can directly enter well-paid jobs at Mass General Brigham when they graduate. All the players are here, Mass General Brigham, the Mayor's Office, Boston Public Schools. Our job at Bloomberg Philanthropies has been to bring these groups together and kickstart and de-risk the project up front with our private funding. But the overall goal of this partnership for this and for 9 other countries around the country with a total investment of $250 million is for them to be sustainable and for them to also inspire other healthcare systems and school districts around the country to launch similar models. As we began to look for partners for this project, Boston clearly stood out as a place where we should go visit. As you know, Mike Bloomberg is from Boston and has a long commitment to supporting educational and cultural projects around the city. Mike has also long admired Mayor Wu's leadership and knows that she is someone who can get things done. Mass General Brigham is a world-renowned hospital whose reputation can attract other healthcare systems to pursue similar schools. They've shown tremendous commitment to this project from the very beginning. And the EMK Academy and Dr. Walker Gregory are already doing a remarkable job. We're lucky to be able to build on their impressive work. Thank you all for your dedication and partnership to make that happen. My hope is that 10 years from now, we'll be back here with hundreds of EMK graduates working at Mass General. And let's clap for that. And at hospitals around the country who are following your lead. So thank you again, and it is my pleasure to introduce someone who has been such a trailblazer and leader in this work, Dr. Walker Gregory.
That was wonderful. I think everybody has already taken all my speeches for today. But I really can't thank everybody enough for this amazing opportunity. And I always like to lead with gratitude. So I like for the Bloomberg Philanthropies, if you could come up, just a small token of our appreciation. Thank you. I also like to recognize Dr. Ann Klibanski and the entire MGB team and their remarkable partnership. Come on up. also want to take this time to recognize the greatest mayor in the city of Boston and her amazing team. Come on up, Mary. And last, our wonderful and remarkable and phenomenal Superintendent Mary Skipper. Come on up, Mary. It takes a village, folks. And when you have the right people in the room, you can make anything happen. So I thank Bloomberg Philanthropies for bringing the folks to the table to make this happen. Let me tell you a little bit of history of our school. EMK was founded in 1995 by a group of community health care providers and higher education leaders committed to a more diverse and reflective healthcare workforce at every level. Elmer Freeman is the founder and former board chair. Big shout out to him. Big shout out to Eric Estaves, who's currently our board chair. Big shout out to Diane Bassett, who's been on my side through this whole process. EMK is a college preparatory and vocational high school for Boston students exploring careers in health and science with the best staff in the city of Boston. Please give them a round of applause. With Bloomberg Philanthropies' financial support, EMK enrollment will increase to 800 students in grades 9 through 12 over the next 5 years. EMK also intends to add 7th and 8th grades in the later years of the expansion. Each pathway in grade 11 is designed to help students build critical and specialized skills within their chosen pathway through a combination of traditional classroom-based learning, specialized health-oriented curriculum, and work-based learning designed in partnership with Mass General Brigham. In the early high school grades, work-based learning will consist of hospital visits, job shadowing, and participation in simulation labs. Hands-on learning will allow students to apply concepts from the classroom as they transition to deeper and more extensive work-based learning experiences, in addition to culminating in paid internships in grades 11 and 12. Students in all pathways begin their twice-weekly clinical practice in grade 11, first in specialized school-based skills for their pathway, and then through placement at partner healthcare facilities. These more intensive work-based learning placements continue in grade 12. Many students will also participate in health careers-focused paid after-school and summer internships beginning this summer after grade 9. Every EMK student will have the opportunity to also earn undergraduate credit, college credits, at no cost to them through dual enrollment or early college partnerships with 2- and 4-year higher education partners whose course offerings align with EMK's healthcare pathways. EMK students are the future of the healthcare workforce in Boston. And through strengthening our partnership with Mass General Brigham, we will meet the needs of their workforce and the dreams of our students. I'm so proud that the Bloomberg Philanthropies has invested in the urgency of healthcare by supporting the vision and the mission of EMK and the Boston Public Schools. I can't believe I would be saying this, but I wish I was a teenager again. This is a great time to be a teenager in the city of Boston. The opportunities are just endless. If you want to learn more about our school, please do not hesitate to visit our website at kennedyacademy.org. But now, let's hear from some of our kids. So can I have Efferson join me and Allison join me?
My name is Efson Meyer, and I live in Roxbury. I am a senior at EMK, Edward M. Kennedy Academy for Health Careers, and I recently was a recipient of the Posse Scholarship, which grants me full tuition scholarship to Rutgers University. At Rutgers, I plan on double majoring in political and environmental science in hopes of pursuing a career in public health policy. My inspiration in public health policy stems from my current job. I am a participant in the Student Success Jobs Program, SSJP, which is as a student intern under the leadership of Dr. Higgins, who serves both as my mentor and the president of Brigham Women's Hospital. Through this role, I have been able to attain knowledge regarding public health policy from my additional mentors, including Carolyn Flynn, who's the Chief of Staff, and Dr. Morris, who's the Chief Medical Officer. These mentors have been a huge role model and have encouraged me as I embark on my journey to college and beyond. Thank you, Dr. Higgins, for seeing great potential in me and offering me this tremendous opportunity to learn from your cabinet. I hope that you continue to instill the same confidence and insight in other students in the same way that you have impacted me. Thank you, Bloomberg Philanthropies, for deepening our school's partnership. And finally, thank you, Dr. Walker Gregory, for your continued persistence and advocacy for our school's needs.
Hello, my name is Allison Johnson, and I live in Dorchester. I am a freshman and a member of the Student Council and Debate Team at the Edward M. Kennedy Academy for a Health Career, EMK. I chose EMK because of its nursing pathway. When Dr. Walker Gregory shared with us this amazing news, I was in shock. My classmates will soon have access to 3 additional pathways: surgery, medical imaging, imaging, and biotechnology. I am interested in exploring these pathways, but at the moment, I am interested in becoming a labor and delivery nurse. My dream is to attend Harvard University, and I believe with the support of my teachers and my school counselors, I will get there. I love my school, and I still have 3 years ahead of me. I am excited about the partnership and the opportunities it will provide me and my classmates. Thank you, Bloomberg Philanthropies.
That was wonderful. I know a lot of you wanted to speak today, but we were only able to take 2 students, but that's okay, your time will come. At this time, we are excited to have our BTU president here, Jessica Tang. Please come to the podium and welcome her with a round of applause. Thank you.
Good afternoon, everyone. I am so thrilled to be here on behalf of our 10,000 retired and in-service educators of Boston Public Schools for this really amazing and historic investment and announcement. And, on their behalf, I want to personally thank Bloomberg Philanthropies. This is exactly the type of visionary change that the AFT and unions across the nation have been advocating for. Cities like Cleveland at Lincoln West have had similar programs established in support with their local teachers union, Cleveland Teachers Union. And we in Boston are so excited to be a partner in this investment as well and ensure that it's going to be successful. And this, again, is a visionary change that I know we share with the mayor and Superintendent Skipper, and know that this is the time that we can not just have a successful program, but be a model for other cities in what's possible in terms of establishing career pathways. And so again, on behalf of the educators also of the EMK, we're just so thrilled that our students are going to be able to have this opportunity. And lastly, you know, this is really a quadruple win. I was going to say a triple win, but I was thinking about it. It's really a quadruple win because it's a win for our patients, it's a win for our hospitals, it's a win for our students, but it's also a win for our communities because all of these different entities are going to be benefiting from this historic investment. And so, again, we at the BTU and the educators at EMK are definitely going to do our part to make sure that this program, you know, is not just an investment for today, but investment in the future for all of the city of Boston and also cities across the nation where, again, this is the visionary change that we need to see. Pathways of careers that are embedded in our hospitals and other sectors where there is a need for employees. And so, again, thank you so much, and thank you for your investment, and we will, again, do our part. Thank you. And at this point, I also have the pleasure of introducing the woman who has really come back to Boston to stabilize our school district and work with our mayor to see out a vision where all of our Boston public schools have a renewed sense of purpose and renewed opportunities. And so it is a great pleasure to introduce Superintendent Skipper, Superintendent of the Boston Public Schools.
I know in some districts, we are not as fortunate to have a union and a district that work so closely together, but it's always my honor to have Jess here and at any of our opportunities, and most importantly, to give her a hug. So what a great day, right? You know, we're so excited for this grant and opportunity from Bloomberg Philanthropies and with our partnership with MGB, and most importantly for EMK. And have I said it was $37.8 million? Yeah. So, you know, this allows us to do a number of things, but most importantly, it allows us to expand pathways for young people for healthcare and to do it at EMK so that they will now be double in size. And what I want to add is there's 400 students yearly that are on the wait list of EMK who desperately want to get into healthcare, they want to build out that education, and prior to this opportunity, we haven't been able to do that. So another big win for what you've allowed us to do to give our students in Boston such an opportunity. You know, here in BPS, we really are trying to orient to a student-first approach. And, you know, with that, we're talking about investing in the whole child. We're pursuing so many different innovative ways to provide our students with both the rigor of academics and opportunities outside the classroom for their learning. EMK is certainly one example of this, where our graduates are prepared to move on to college or to enter into the medical workforce, filling the crucial roles you've heard about, 2,000 of them, in our Boston's world-class medical facilities. And this opportunity gets us that much closer. You know, one of the things is more of our students from EMK enter the medical field, it'll become more representative of the diverse community, amazing diverse community of Boston. You know, we will now have staff who share the experiences with patients, staff who can speak multiple languages, which is so important when a patient is feeling vulnerable, and staff that are both passionate about their work and prepared for it. We're so appreciative of this partnership because it really is a chance to expose more of our students to the possibility of a career in a medical field here in Boston. They don't have to go elsewhere. The jobs are here. The institutions are here. MGB is here. EMK serves as a blueprint, a model, not just for our other Boston public schools of what's possible, but also for the rest of the country. You know, really of what can happen when you get philanthropy and a strong partner like MGB at the table to be able to develop out an interest in an industry as important that touches every single person in this room as medical care. So I want to thank our community partners like MGB that are coming to the table and have been in a history of partnership with EMK. I also want to thank Mayor Wu and the City of Boston, best mayor ever, for the support in really bringing innovative partnerships to our schools. I want to thank Dr. Walker for her many years of leadership in the BPS at a school and a district level. And I want to thank our EMK students, because I want everybody to just look for a minute. So for our EMK students, not only are you showing us today what's possible in the future, but more important, you are reinforcing what our why is in this room. So thank you for that, and congratulations.
So I want to end by thanking all of our speakers for joining us today for this exciting and transformational announcement. We could not be more thrilled to launch, and we are itching to get out there and welcome our students, welcome you all to Mass General Brigham. I want to specifically thank Mayor Michael Bloomberg and the team at Bloomberg Philanthropies for their remarkable vision and incredible commitment to our students and the healthcare workforce of tomorrow. I want to acknowledge Mayor Wu, Superintendent Skipper, Dr. Caren Walker Gregory, Dr. Klibanski, and all our partners who have made today possible. And I also want to turn to the students who are here today. I can tell you that I see myself in your shoes. If my family had come to Boston instead of New York City, when they were economic migrants to the city of Boston, the first in my family to go to college, the first in my family to ever think of walking into a hospital and being a medical student, being a doctor that I am today, it is possible. We cannot wait to welcome you across our Mass General Brigham hospitals, and we are so thrilled about this exciting announcement and exciting program. And with that, I'd like to invite all of the students up here. We have a little gift for you before we conclude our program. Please come up to the podium. We want you back to be a labor and delivery nurse at Mass General Brigham. Thank you for coming today. Thank you so much. You're welcome. Thank you for coming. Of course. Thank you. You're so welcome. Thanks for coming. You're so welcome. Future labor and delivery nurses, future pediatricians, future surgeons. We're so excited. Before we conclude our program, I want to welcome all of you and invite you to please join us at the back of the program as students work with the team from Mass General Hospital's Lunder Learning Hospital, where we bring teaching cases to life through our simulation work and high-fidelity simulation programs that the students will also experience. And really, another thank you for everybody coming out today. We actually do have a couple of minutes to take questions from the media, if there are any. And I will invite Dr. Caren Walker Gregory and Jenny Kane to come and join me in case there are questions for the school and for Bloomberg Philanthropies. Thank you once again. Yes?
Talk about the importance of a 14-year-old freshman going into high school with a specific target, knowing he or she is interested in that field, they're going to have a good career. Talk about what that does to a freshman in high school who's responding to this, and talk about that.
Happy to. It's a dream, really. If you have a 14-year-old that's interested in the health careers, please apply to our school. It's a great opportunity to, at 14, you're not exactly sure what you want to do, but our job as leaders and staff is to educate 9th and 10th grade all of the health professions that are out there Because sometimes they only think about nursing. There is lots of professions out there. And with the partnership with Mass General Brigham and the support of the Bloomberg Philanthropies, it's just widening our opportunities for kids. So again, our job is to educate them so that they have choices. It's all about choice.
Thank you all for taking questions. I was wondering if you could say a little bit more about what the commitment Mass General Brigham is making in terms of job opportunities for the graduating students from EMK.
I'm happy to take that. So there are a number of things that we will be part of the initiative that Bloomberg is doing actually across the other 9 awardees, including Boston. The work-based learning means that the students will be coming to Mass General Brigham at our 2 nationally ranked academic medical centers where they'll have summer internships, they'll have after-school jobs. We will be participating in the curriculum development for the 5 pathways that you heard of. And we will also be supporting a number of services at EMK to really support the success of the students through academic tutoring, through opportunities for mentorship. So it's a number of initiatives and activities to not only welcome the students into our workplace, to have that experiential learning, but also experiences and activities at the school in order to ensure the success of the students. So it's a wide-ranging initiative, and I wonder, Jenny, if you can speak to the similarity of the other programs and similarities in what they're going to offer.
So across the board, I think the most important part of this initiative was having the commitment from the healthcare system to not only train students within the hospital setting, design the curriculum, go into the schools, but also commit to hiring the people who have successfully completed the program. So depending on what different path that you might take within the school, there are open jobs at the end if you successfully complete the program, including certification credentialing that you'll take within high school, work-based learning opportunities at the hospital system, and if you successfully complete those. And the other thing that we asked all healthcare systems to commit to is ongoing education. So if a student decides to go directly into the workforce, into the healthcare environment, that the healthcare system will support them in continuing education over the longer term so that they can get higher wages and more advanced careers.
And that commitment to open jobs, does that mean there's 20 slots that EMK students will get, or they'll get interviews if they want them? What does that mean exactly?
So there's no number on this. It's really about providing opportunities for kids, and so when the opportunity comes, they are ready, right? So I don't want to put a number on that.
And if I can add, Mass General Brigham is already one of the largest employers, summer employers of students, and we could not be more proud of that distinction. And so that will continue. But we will also make opportunities available specifically to the students that are going through the pathways. So it's, I think it's over 200. I'm looking at Christy Egan, the director of our youth programs. Over 200 students every single summer have participated in summer jobs throughout Mass General Brigham, and that will continue. I think we have time for maybe one more question if there is any. And seeing none, I will welcome you. Thank you again for coming. Sure, Mayor Wu.
Of course. I've just been sitting here and reflecting on so much of what we heard and our incredible student speakers, and I was overcome with this feeling of what does this actually mean, right? There's numbers, there's a lot of details to work out, there's dollars, there's statistics around vacancies. But the superintendent might know what I'm going to say next about an experience we had before the start of the school year. One thing that the Boston Public Schools do every single year is before the first day of school, we have a list of students and young people whose absences from school the year before were above a number that we feel would allow them to really take full advantage of their education. And so we get lists, we get addresses, and the top leadership from the district and volunteers from the community go out and go to each door of those young people to say, what can we do to help support? And often when you're having those conversations in the doorway of a family, there was a medical issue that became a barrier. There was a rent issue. The family was facing eviction or displacement. There's all these other things that wrap into education. And as we try to show up with school supplies and words of encouragement and asks for how we could do better as a city and a district, we learned so much in those conversations. And the superintendent and I were at one door this past September, August, and a young lady opened the door and shared that there had been some challenges that she was working through in her family and in her life. And then we figured out that we could bring in supports on a number of those different issues. And then we asked the question, what would get you really excited for this next school year? And she paused and thought about it a little bit and said, you know, what I really want to do is become a nurse. And when the superintendent said, well, we have a school for that, her eyes widened. And that sense that our young people already know and are ready, and we just have to make sure they know about the opportunities and make it available to more people. We know that she's going to change lives and save lives. I'm sitting here in this seat and remembering back to the first time that I was at Mass General, I was terrified because I was in the emergency room. My mom had just been transported by ambulance after a mental health crisis. She was just about to be kind of formally diagnosed with late onset schizophrenia. And in the middle of the night, she had had a pretty bad incident. Someone in the area had called the police on her. I begged for them to take her to the hospital instead, and we arrived here. And I remember being so scared because I had been taught my whole life growing up in an immigrant family to just kind of keep your head down, try to stay out of trouble. And here we are in this large institution, having dealt with the police, having arrived here in the midst of just such fear and anxiety. And this is the institution that I believe saved her life. She stayed here for a week, inpatient, began to get treatment, began to get that sense of care. But it took a while for our whole family to feel like we belonged here, to feel like this world-class institution was actually one that we could access. And so to know now that that young woman we were in the doorway of is going to be there to receive those families coming in through the emergency room, that you're going to be there to welcome those babies into the world, that's going to mean the whole world for all of our families. And we're so thankful to everyone. It's way more than the numbers.
Thank you, everyone, for coming.
Thank you so much for everything.
Yes.